Hi, Eastern States. It's Bill Thompson again. And I just want to first of all thank the communications and marketing team for all their work in putting these recaps together. As you could see through the last few days, there's several interviews we had with some key researchers and scientists from Eastern States. And they did a lot of work to make these happen. So please make sure you're sharing them. I want to also thank Jalen Brown for being on site and making sure that she's capturing some of the folks from Eastern States and working with the staff here as well as with the volunteers. So thank you to Jalen on that. I mentioned in my first video the importance of the American Heart Association, what we do in bringing together scientists and researchers from across the globe. And we are the international conveners of this work. And without us, we would not have the ability to not only share this information, but to network, collaborate, and bring into effect new opportunities for scientific breakthroughs. There's been a number of things that we've seen in late-breaking science, and you've been able to read some of those through Nancy's information. So I won't go through theirs, but I will say there's been great conversations about healthcare by food. There's been great conversations about CKMH, and there's been a lot of work going on around our CPR guidelines and resuscitation. I happen to see one about the impact of infants and response rates with infants and what the breaths means for infants and the difference in ethnic population there, which is very interesting. One of the things that I thought was really important was the other piece that this does that we don't think enough about is how much this brings about curiosity and what's the next question we need to ask. And we heard a lot about that. After every session, there was an opportunity for people to ask questions and dig deeper into what the research was. And so more questions are being asked. And then what the result of those questions that are being asked is going to bring in future sessions. And then the question that we need to ask ourselves, and Nancy brought it forward, was what can we now do as an organization with what those questions are? So much going on here, and I just so much appreciate all the work that goes into this. And proud days for the American Heart Association when we are all here and we take over a city with people from across the globe trying to make a difference in cardiovascular health. So thank you.